Hi, I am Dr. Vishal Gupta and I am a consultant pulmonologist at the Chest Care Clinic Kharghar in Navi Mumbai. Today's topic is about pulmonary hypertension, and the information of pulmonary hypertension is quite limited. So, we like to share this video to those people who have a lung condition or they are knowing someone else who has a lung condition for a long time and their symptoms have been difficult to manage. Pulmonary hypertension is basically a situation which happens to people who are having existing lung problems or heart problems, and this is leading to difficulty in the blood passing from the heart to the lungs and coming back to the heart from carrying the oxygen back into its system. So it is basically high pressure problems that is affecting the heart and that is leading to a failure like symptoms. And many of the lung conditions, which is mainly chronic obstructive pulmonary disease, COPD, interstitial lung diseases, occupational lung diseases, kyphoscoliosis and restrictive lung diseases, neuromuscular diseases, and myasthenia gravis. And these some conditions like autoimmune lung disease and systemic sclerosis, which are causing tightness of the chest wall, are affecting the patient's breathing, and therefore the patient's pulmonary arteries also become narrower over a period of time, and this causes pulmonary hypertension in these patients. The symptoms that most of our patients come to us is basically breathing difficulty. They are having difficulty in doing day-to-day activities, which is over and above their previous problem. So they were previously taking treatment, they were better, and after that, new problems start happening after a couple of years. They are now feeling more fatigued. They are having new chest problems, new chest discomfort, swelling in the legs, swelling over the face, and certain heart complications which are unexplainable by the existing previous lung condition. So this is how we suspect these patients could have any heart pulmonary hypertension. And usually we have to examine the patient. We look for the jugular venous pressure, it's engorged. We look for the facial puffiness. We look for leg swelling. We will look for cardiac auscultation findings. And the lung condition or the other previous condition doesn't seem to have changed much. So we need to assess this patient over a period of time and check for regular weight monitoring. And if we see the weight has been increasing, that again raises strong possibilities of pulmonary hypertension. Also, the patients while walking, they have dropping in the oxygen levels, and the oxygen level doesn't recover easily to the normal. That means the pulmonary arteries are not functioning as per expectation. To confirm this, we require to do heart ultrasounds like 2D echo, sometimes radiographic evaluation of the lungs, that is CT scan of the lungs, and contrast enhanced pulmonary angiograms to look for any clots inside these lungs, which can alter the treatment course. Rarely we require to do a right heart catheterization and also check based on medications which medicine is giving us the best response to pulmonary artery dilators, and this is what helps us decide which medicine is most appropriate. We also need to look at the existing lung problems and other lung issues like sleep apnea if they are there, which needs to be corrected, which if corrected these patients can get normalized from their pulmonary hypertension and they can continue on their existing lung problems treatment, which can give them the good resolution. The medications that are often used are we have to encourage them to have a better lifestyle. So the first thing is to encourage a lifestyle modification, and these people will require to have special kind of exercises which are called pulmonary rehabilitation to be followed. Along with that, they should be having a regular healthy diet and also manage their weight. They should be maintaining a specific amount of weight. By regular following up, we need to know the weight and also check how much fluid is appropriately allowed for this patient to take, because overconsumption of water and dehydration are both problematic. We need to counsel them to have no habits like smoking and alcohol, because this can worsen the existing conditions. And those patients who have sleep apnea should be on CPAP therapy, at least following up with their sleep specialists, pulmonologists, and or cardiologists on a regular basis. Certain medicines like diuretics, pulmonary artery vasodilators, and endothelin receptor antagonists can help the symptoms get very much better. And this is used for a selected group of patients only. And the symptoms of the heart pressure being high, if they are controlled, they can make the person near normal in their day-to-day activities. Many of the patients who are having type 2 respiratory failure and those patients who are having COPD and kyphoscoliosis, they do very well with home non-invasive ventilation. So that is one of the primary things that we should be driving them at their problems. And those patients who have ILD and other conditions who are at home with oxygen, their oxygen therapy helps the pulmonary artery vasodilatation. So it is a very, very important part of the treatment. When we see a patient with pulmonary artery hypertension with a lung condition, we consider to start them early on with home oxygen therapy, which is what we call long-term oxygen therapy. This is important to note that if patients are picked up early, their treatment is more successful and there is less chance of death due to these particular problems. If the patient is rapidly progressed, or if the patient has got a very delayed presentation, or patient has come late to the doctor, to the specialist, then the success of treatment is quite poor. So we always recommend that by giving this information and by giving more ideas about this disease, earlier pickup of this disease is possible. So if patient follows up early to the doctor and follows up regularly and takes his medications very properly, there is a high chance that pulmonary hypertension can be picked up early and treated very early, so patients are leading a normal healthy life in the future with their medications. I hope that this video was useful to you, and if you would like this video, don't forget to click the like button. If you would like more such videos, don't forget to drop us a comment on which kind of videos you feel you would like to hear on, and don't forget to subscribe to our channel on YouTube and follow us on Instagram. If you feel that this video could help someone else, don't forget to share to this video. Thank you very much for given your time today. Until then, namaste.